Hello, I'm Dr. Andrea Durst, an assistant professor in the Department of Human Genetics. First, welcome to Pitt and the Graduate School of Public Health. The Graduate School of Public Health offers a number of certificate options for students to pursue, and I'm excited to talk with you today about their certificate program in public health genetics. So let me start with an overview of the certificate program and its objectives. The Public Health Genetics Certificate aims to provide students with additional training that's focused on the intersection of genetics with public health. This is an important, cutting-edge, and evolving area of public health because advances in genetics are occurring at a significant pace, and society is really challenged to respond to many of the social, legal, ethical, and public health policy implications of this new knowledge. Additionally, genetics is becoming an important component of many public health initiatives and research, making an understanding of genetics important for public health professionals. And on the flip side, public health approaches are being integrated into clinical genetics services to address issues including access to services and education of providers and the public. So the objectives of this certificate include that at the completion of the program, students should be able to demonstrate basic knowledge of the role that genetics plays in the development of disease, identify ethical and medical limitations to genetic testing, including uses that don't benefit the individual, identify the role of cultural, social, behavioral, environmental, and genetic factors in the development and prevention of genetic-related diseases, and finally, to identify the limits of their genetics expertise. This slide just lists the certificate administrators for the certificate program in public health, and those are myself and Dr. Kammerer. We are both faculty members in the Department of Human Genetics and also on the program leadership team for the MPH program in public health genetics. So next I wanted to review the requirements for the completion of the certificate program. The certificate is a total of 15 credits, and at least 12 of those credits must be taken as course credits. The remaining 3 credits can then be taken as seminar, as a specific project, and have credits for that, or practicum work with credits for that work. And that's really left up to the student. The only required course for the certificate program is the Introduction to Public Health Genetics course, or HUGEN 2049. Students will then choose an additional 6 credits of coursework from our core human genetics curriculum, and those course options are listed here on this slide. Students may also choose to take additional courses in other departments within the Graduate School of Public Health or in the Department of Human Genetics, depending on their goals for the certificate program. And finally, in addition to the course and experiential requirements, students are also required to give an educational presentation in a public health genetics course during their time in the program. One thing that I did want to note is that students who are already in a human genetics degree program other than the MPH program can also pursue the public health genetics certificate. And in this situation, there are some slightly different requirements because of the overlap in the core coursework of the degree and the certificate programs. So if you are a student in the human genetics department and you are interested in the public health genetics certificate program, please contact myself or Dr. Kammerer, and we would be happy to talk with you more about what that looks like. So there are a number of benefits to the certificate program in public health genetics, and students pursue the certificate for a number of different reasons. As such, we really have built in many options for customization into the program so that students are able to maximize the benefits that they receive from the program and are able to customize that so that it meets their career goals after graduation as well. Additional benefits of the program include that the certificate program provides graduates with a basic grounding in genetics and public health genetics. And then these skills can really be taken into a current or new position, allowing a graduate to function at the cutting edge of this new public health specialty. There are a number of initiatives that are currently in place that encompass public health genetics. Some of these include newborn screening programs, which are run in every state in the U.S. as well as many countries internationally. There is a lot being done around public and provider education regarding genetics and genetic conditions, and there is much more work to be done in this area as well. There is really work to be done around expanding testing guidelines and test offerings. So as more and more individuals are becoming appropriate for genetic counseling and testing, it's important to think about how we get services to these individuals, how can we appropriately educate patients and providers and even the public at large, just so that they know that these are options for them and how they might impact their healthcare in the future. There are a number of precision medicine initiatives in the US and internationally as well. As you may know, Pitt is one of the major recruitment sites for the All of Us Precision Medicine study. And as precision medicine continues to gain ground, we're going to see the integration of genetics into primary care and other areas of medicine in ways that we really haven't seen before. And there are a number of issues to consider when we think about how that integration is going to go from a public health perspective. There are a number of initiatives being done in regards to cancer genomics at a public health level. Many state public health departments are integrating genetics and genomics goals into their state cancer control plans, for example. And then finally, there is a lot of work to be done in thinking about how we increase access to genetic services, especially among underserved populations. And so all of these are areas of work that individuals interested in public health genetics might pursue, and there are many others in addition to this as well. So I hope that this information that I presented today on the certificate program in public health genetics has been helpful to you if you're considering this certificate program. If you have additional questions or are interested in the certificate program, please reach out to either me or Dr. Kammerer, and we will be happy to walk you through the next steps. Our email addresses are included on this slide, so please feel free to contact us via email. Then I just wanted to say thank you for giving me the time to share some information about our certificate program. I'd be happy again to answer any questions by email. Thank you.